Hi everyone, Prem Tripathi, facial plastic surgeon in the Bay Area. I'm here to talk to you about everything blepharoplasty today, so make sure to like and subscribe so you get notified about these videos. I'm going to try and go in depth for everything face on this channel. So what is a blepharoplasty and why is it important? A blepharoplasty can be an eyelid surgery for the upper eyelid or the lower eyelid. But the complicated part about this surgery is that it's an interplay between the position of your brow, the position of your crease, whether there's fat involved, whether the skin is crepey, whether areas need to be brightened or shadows need to be modified. So it is a complex area and it's always recommended that you go to an expert. So today I'm going to focus mostly on the upper eyelid blepharoplasty because there is a lot of confusion about something called an eyelid lift or whether this procedure actually lifts the eyelid at all. So here's the thing. A traditional blepharoplasty removes excess skin in the upper eyelid. This is skin that has sort of come down over time towards the lash line, and as it comes down towards the lash line, it tends to make the eyes look tired, look more downturned, makes it harder to put your makeup on if you wear makeup, and it also creates a sort of sad appearance to the upper part of the face. Really, the eyes are where everyone looks, and surgery is aimed at taking away attention from areas that bother you or areas that don't look natural back to your eyes, because again, that's how you communicate non-verbally, and this is an area that most people look at. So what we're trying to do is just get more brightness back to the eyes. And so by removing skin here, you can have more of that crease that's showing, so you can put your makeup on and your eyes just naturally look brighter, you look more awake, there's less of that you look tired sort of thing, and people feel on the inside and look on the outside incongruency. They look on the outside just as well as they feel. That's really the approach. But here's the other thing about upper eyelid blepharoplasty. I'm going to talk about the incision now. That incision is generally hidden in the crease, but the way the incision is on the outside part of the eye matters so much, and it really truly dictates the overall result. So let me give you an example. If that incision is hidden in the crease and then comes down towards the outer part of your eye instead of going up, it can change the entire appearance of your eye. It can really make you look less bright than if that incision is taken upward. One reason why that incision is sometimes not taken upward is some people are scared that it is going to leave a noticeable scar. Truthfully, even though the skin is thicker, it's not going to leave a noticeable scar there if it's closed properly. So the way I do my upper blepharoplasty incisions is in the crease and then up towards the eyebrow, so I can really focus on this lateral skin, which tends to be the skin that hangs down the most. It's the skin that people don't like, and it's the skin that people can see in pictures from the side. So one way that we modify that is by taking skin and cutting it almost like a wing, so that you can imagine it like you're wearing winged eyeliner. I cut it like a wing in that area, and so when it's sutured, it heals really, really nicely. That matters. Who would be a good candidate for a blepharoplasty? The people that are good candidates for blepharoplasty first obviously need to have a comprehensive consultation with an expert to make sure that they're not missing anything. But the things that we're looking at are, where is your brow positioned? How much excess skin do you have? Is there fat in this corner right here? Is it obscuring your vision? And where are the extra pieces of skin in addition to other things? So you might go into your consultation and wonder, is a blepharoplasty the right thing for me? I'm bothered by some hooding. But you might have very deep set eyes and a bone that sticks out. Like me, for example, my eyes are sort of set back. I don't have a lot of excess skin, but skin removal is not going to do anything for this bone. Some people may actually have ptotic or heavy brows. If your brows are pushed down, then this might look like extra eyelid skin when really it's brow skin. And so you might benefit from having something called a brow lift, where the brow is lifted at the same time or at different times from that blepharoplasty. Who else is a candidate? If you have a traditional roll of skin that's extra, whether that's genetic, you might be in your 20s and bothered by it, or older than that, and it's gotten worse over time, those tend to be the best candidates. This procedure, and how is it done? So this procedure is relatively straightforward. It's done in the office with local anesthesia, meaning that we inject numbing medication under the skin. It takes about 10 minutes for that to take full effect. The procedure takes maybe another 30 minutes or so, and then you're done. You get to go home. You can drive yourself to the procedure if you want, or you can have a ride. But the easiest thing about this procedure is it doesn't require any sedation or anesthesia. If you are getting an upper eyelid surgery, you can do it with other adjunct procedures procedures, but if this is the only thing that bothers you and it's the only thing that is recommended, you can just do it in the office, which is really, really nice. And the sutures usually come out in about 5 days. The nice thing about upper eyelid blepharoplasty in the office is that we can also remove fat from the corners. So if you notice that some people have bags or puffiness in the under eye area, they can also have bags here in the corner of their eye. And many surgeons, unfortunately, whether they notice it or not, will sometimes leave that bag behind. That bag can make the upper eyelid look so aged and unnatural, especially when the skin is removed. So at the same time of removing eyelid skin from here, I will take fat from the corners, whether if it's starting to come forward or if it's obviously very noticeable, that fat is removed to contour that area. And that can also be done in the office. I've had patients that have had revision eyelid surgeries because all that was left was that fat bag, and it was very, very noticeable after the surgery. So remember, that can be done in the office as well. What's the healing like? An upper eyelid blepharoplasty is relatively easy to heal from, but you have to remember that because it's right on the front of the face, you are going to bruise. That bruising starts in the lids. It creates a really nice sort of pink eyeliner effect, and then the bruising goes down into the face. So after about 7 to 10 days, most of the bruising is gone. At about 5 to 7 days, you can put some makeup on to cover it, but you're gonna bruise sort of no matter what. Some people don't bruise very much. Some people have a pretty intense bruising response from the procedure. It doesn't mean that you feel bad. It doesn't mean that you can't go back to work. It really just is a function of social downtime. How bothered are you about the bruising? If you're not bothered by the bruising, you can go back to work. I've had patients go back to work with stitches. Otherwise, you could take some time off and just kind of relax. But in terms of activities, in terms of normal day-to-day things, there's almost no restriction. I do recommend no heavy lifting for about a week, but after that, you can go back to normal activities. You can work out, you can cook and clean and see your friends. After 5 days, the sutures are removed. I give you scar gel, and then it's sort of easy street until the 3rd week. The 3rd week, I notice that the healing period starts to change a little bit. Your body goes into overdrive to repair that incision, and sometimes some patients can get a little thickening or ropiness of that incision, which can last a few weeks to a few months depending on that person. But rest assured, it's going to get better. I always make this sort of comment when I'm talking to patients about upper eyelid blepharoplasty that I laser scars all the time, but it's so rare, if ever, that I've ever had to laser an eyelid scar because the anatomy of the eyelid is so interesting. It is thinner skin. It's some of the thinnest skin on the face and the thinnest skin on the body, and because that skin is thin, it tends to heal very, very well. So even though your scar may look terrible to you at first, these scars are very imperceptible. And I always say that surgery leaves a scar, but truly upper eyelid blepharoplasty should not be leaving a noticeable scar, even at a very close distance. Conversational distance, definitely not, when all the healing is said and done. Is it common to get this procedure done with other ones? Absolutely. You can have an upper eyelid blepharoplasty definitely with the lower eyelids. That is for another day, another video. But remember, it's kind of like renovating your house. If you do your kitchen, then the bathrooms start to bother you. So if you're bothered already about your lower eyelids, chances are if you do your uppers, you might still be bothered. It's not a reason to do it, but it is something to consider if you're going under the knife or if you're going to have anesthesia anyway. If you have questions about blepharoplasty, facial aesthetics, facial cosmetic surgery, or any of the above, leave them in the comments below, and I'll see you guys next time.